Community decision making is the most important. It's not the most easiest at times, but it's the most important with the service delivery. Unfortunately, at times though, with the political environment, it's very easy to be told top-down approach what should be done from government, such as you will notice that there is the National Chronic Disease Package at the moment. There's always a flavour with the political agenda, and that's only just from my observations personally in the 14 years I've worked in the sector. Was when I first started, it was mental health. So Beyond Blue and mental health services were blossoming all over the country. Then that died down. Then it became social determinants of health and primary health care. Then that sort of waned off. So there's always a flavour for the politicians to say they're doing something for the Aboriginal community. And sometimes we do have to go with that. But that can cause angst as well for the Aboriginal community going, well, we need a dental service, or we need more put into maternal health, you know, we need to get our babies stronger and healthier. It's not very easy to try and manage the political agenda and the community's needs, but you don't stop trying, and that's the greatest thing about the ARCHO sector. Chronic disease care, like I said, is a new flavour, but it's something that is most important, and that links into that holistic healthcare approach for us. It's a lot of hard work, but it's getting there. The only thing that we don't want to see is that it just being a flavour and the resources waning off again, because you build up so many years worth of hard work, you build your policies in, you get the workforce happening, you get the training done, and next thing you know, there's not enough funding to keep it going. Chronic disease has been around for many, many years within the Aboriginal communities, and it's not going away anytime soon. Clinical quality improvement approaches, some of those things that AMSANT are doing around that, or the ARCHO sector are doing around that, is around clinical accreditation, building in services, professional development. There are a number of aspects around always continuously building quality improvement within the health services. Supporting Aboriginal staff and developing Aboriginal health practitioners. I think for the ARCHO sector, it is a priority for that, but I think as well the most important thing is that everybody within the health service gets that support, gets that development, gets that training. For us as AMSANT, we don't consider ourselves as colleagues, we consider ourselves as family, and I think that's a value that many Aboriginal health services like the philosophy of. Active in advocacy. Well, AMSANT is an advocacy and lobbying peak body for the Northern Territory, but the health services are too. It's important to look at those social determinants of health, the environmental factors around housing, racism. Everyone would have probably seen with the footy that the racism issue has flared up again as well. And the fact that it's something that will never go away, but it's something that we'll always keep advocating for to make sure that it's the education and it's the way that we pride ourselves in what we do that we feel we're leading by example in. So, for instance, with the NT, like we've been talking about with the chronic disease package, already with the amount of work that we've done over the last few years with chronic disease, the COAG target of halving life expectancy by 2031, the NT is leading that. And that again is a lot of hard work from AMSANT, from its members, but also its partnerships like I was talking about with the likes of Medicare Local, NT-GPE and Department of Health. There has been a reduction in child mortality and improvements in chronic disease outcomes, and I'm sorry, I would have loved to have put some slides in of the data because there is some graphs that we do have proving these points, but we're definitely proving that it can be achieved, but it's important that the commitment remains for us to be able to achieve that by 2031. The Community Controlled Health Service, proud of the comprehensive primary and preventative care model which has proved better health comes. Like I said, it's important for us with leading this by having the community control their own health, and it's proving to be successful. Often you find that those that do access the GP services are because the demand on the Aboriginal Community Controlled Health Service itself is so great that a lot of people aren't actually able to access the service. And although those that do go to the GP service come away with whatever needs, initial needs are met, they still feel that going back to the Aboriginal Health Service is the most important for them because they know them, they understand them and what they need.